pastor at Heritage Church, and we want to welcome you to Doctors in the House. And as always, we have Dr. Bisham Singh with us, and he is a local physician, and he has had a tremendous impact in working for global and local health facilities and issues around the world. Welcome to the episode, Dr. Singh.
Thank you, Pastor.
Good. And then along with us, we have a guest today. Would you like to introduce our guest, Dr. Singh?
Absolutely. With us today is Dr. Michelle Wiener, and she's a ER physician. They're good friends of mine, Max and Michelle. I've known for a while. She's an ER physician at St. John's Hospital and also at Wayne State. Michelle is in the front lines, and I've been talking to her almost weekly to see what the status is. She is actually, when you see the brave men and women going to do battle, well, Michelle is it. She's the one. And so I'm always concerned what's going on with friends like her. And so we're very honored to have her today. Michelle, would you like to say a few things?
No, for sure. So I forgot to send, when I sent you my bio the other day, I'm apparently now a kindergarten and preschool teacher as well as ER physician. And I think that might be the harder job of all of it. But I do work at St. John, Maine, which is a large level 1 trauma center. We have the second most volume of any ER in the States. And I also work at a very small community hospital as well, called River District, and it's out by Port Huron. So I think that's kind of a good perspective to have both a large, academic medical center where we're working with residents, but also somewhere where you're probably the only doctor in the place for the majority of the day.
That's fantastic. Talking about being a kindergarten teacher, just for a moment, I saw a thing here recently that one of the parents was saying, I wonder if it's too late to transfer my kids to another school. And then I also saw one where the kids were trying on their own to transfer to another school. So yeah, this is going to be a crazy time for parents stepping into that role, but that's a good thing. So you do have a very unique perspective in working both in a large environment and then in a rural environment. What are you seeing on the ground right now with regard to the influx of patients and the COVID-19 explosion that's happening here in the States?
No, for sure. Before I forget, though, I do want to say thank you to everybody in the community. We've had so much love and so much support, and it really does make a huge difference when you're doing a job that's super stressful. When you come into the break room, and the Cub Scouts gave us like a huge box of snacks. So I'm eating my cookies, and they taped all the notes and letters we've been receiving onto our lockers that are like, you guys are doing great, you're rocking this, you're getting through this, and it really does make a big difference. We actually had a bunch of people make us, here, I got this up over here, like homemade masks. So like all the women in the community are sewing, and so we really appreciate it. But we are seeing an influx of corona patients. Actually, it's kind of interesting. ER volume overall is down. We're actually cutting some of our ER staffing, and I know other groups are doing it across the country as well. But the acuity that we're seeing is higher. So that means that we're seeing less patients, but the patients that we are seeing tend to be sicker. Besides the corona, though, I also think it's kind of interesting. We are seeing in both hospitals a ton of alcohol-related injuries and heroin overdoses, because I think people that were doing well, that were in rehab, are stressed out. They're sitting at home. They're losing their jobs. And we're seeing a lot of substance abuse-related issues. The other interesting thing that we're not seeing is the heart attacks, the strokes, the diabetic foot infections that we normally see. And we know those things aren't going away. But the perfect example is I had a patient the other day that said, yeah, I've been doing some home improvement now that I'm home. And I've been having all this heartburn. And I kept saying to my wife, this is really strange. I just don't feel good right here. And she was like, well, we're not going to the hospital. So just take some Tums and suck it up, honey. And, until he collapsed on the floor. And then the ambulance brought him in and he was having a massive heart attack. So I think, we aren't overrun in the ERs right now. So if you are having chest pain, if you are having difficulty breathing, you need to come in. If you have numbness and tingling of your arm, don't just shrug it off and say, well, it went away in 2 hours. We're just not going to go to the hospital for that, because that might be a precursor to a major stroke.
Michelle, you are saying to the community that if you are feeling these symptoms, don't feel that the ER or the hospital is a death zone. do call in the emergency services and do, come in.
Right. I mean, we can get you in and out super fast. We started a plan before all of this started, which I think we're all thankful for, because now we have a mechanism to deal with all of this stuff. But the hospital, they did cancel the non-emergent surgeries, so they would kind of empty out the hospital. We did start setting up, so we have a corona zone, and then, with negative pressure rooms, so the air is not circulating throughout the ER. We are triaging outside of the hospital now, which really helps to separate people with appendicitis versus people with corona, so they're not sitting in the same waiting room. And we can kind of identify those patients early. So don't be afraid. If you cut your finger off, you still probably need to come in and get stitches and some antibiotics. And we do have the capacity.
Michelle, so what happens when somebody does have the symptoms at home? They feel like they may have the coronavirus. They got signs and symptoms of the infection. They're calling the first responder or their family practitioner. What happens? Tell the patients what they should do next.
Okay, so a lot of people are getting symptoms. The first things we're seeing is there's two branches that we're seeing. We're seeing people that get the fevers, nausea, vomiting, diarrhea. So don't just think you ate something bad. It probably is coronavirus. That's more in the younger people. That more elderly population, we're seeing the fevers, headaches, and a lot more respiratory symptoms. But, there's a huge cross between the two. So we're saying, like when you first get the symptoms, treat the fever, Motrin, Tylenol. Usually what we're seeing is the first few days, I have more of the headaches and the fever. The difficulty breathing and the other symptoms aren't really starting until day 4, 5, and 6. So if you are feeling short of breath, a lot of people are calling their doctors or doing like the telemedicine type thing, which I think is great if you're not very symptomatic. But if you're feeling short of breath over the internet, we can't tell if your oxygen levels are very low. And a lot of times these patients come in, they're in their 40s, they look really good, but then we hook them up to the monitor and their oxygen level's at 85% and it's supposed to be over 95%.
Right.
And so we have a lot of patients that are coming in, for sure that are getting discharged, but we also have this large contingent. And I think this is where the hospitals are kind of getting bogged down, that just need oxygen for 4 to 5 days just to supplement, help support their bodies, rest, get better. So if you are feeling short of breath, I would say you need to come in. You can't do it like a telemedicine type visit, or go see your doctor who has the ability to do vital signs, because a lot of people are waiting too long and then they're crashing by the time they're coming in.
Michelle, one of our viewers just asked the question, they sent it in to us by the comment section there on Facebook. Said, do you think people are avoiding coming in with symptoms because they're under the impression that there are no virus tests for them, even if they do come in? Are you hearing that?
That there is a lot of truth to that. So the first 2 weeks that we had the swabs, we were only testing people who were sick enough to go to the ICU. And that's because we only had 200 swabs for all of Michigan. So every hospital got like 10 swabs. And they said just flat out to us, we can't even run all of these. We can only run half of them a day. So it's going to take 5 to 7 days to even get this back. So by the time we were even finding out if people had it, they were already better. So now we got a little bit more swabs. So over the last 4 days, we've been swabbing everybody that's coming into the hospital with it, but we still don't have the capacity. These drive-through things, we're screening people, we're making sure they're safe enough to go home, but we're not swabbing them. And so I think that's a lot of times when you hear these numbers of, oh, well, our numbers went up by 1,000 in Michigan yesterday. That means absolutely nothing. For every person I swab, I probably see 100 people that we're sending home with no swab. We say, we think you absolutely have it, but there's nothing we're going to do. And the hospitals all have the machines now to do it. We were waiting on the reagents so we could actually run the machines. I think we finally have that. So now, as of yesterday, they said we can do some of this on-site testing, which only takes an hour to get back. But we're still really only doing that if you're coming into the hospital and you're sick. We really don't have the capacity yet to do that for the community at large. And to be honest, the testing, besides just giving us some good numbers to know who has it and who does it doesn't really help us treat people. We do it based on the symptoms, the fever. We presume you have it. It's not like there's a magic treatment we can give you if the swab comes back positive to know if you have it or not. And so a lot of what we're seeing with, are we surging, are we not surging? We're just doing it based on the hospital numbers like New York is. How many people are coming into the hospital per day? How many people need to be admitted? And, New York now is thinking they're on the downslope of that curve because they're having less people come in. And that's kind of what we're doing. We're gauging it by.
Yeah, I read an article. There's been a couple of articles in the Free Press that had an interview with John Fox. He's the CEO of Beaumont Hospitals, which is the largest hospital provider here in the state of Michigan. And he was talking about the fact that they had a few days where their ERs were overrun. But now it's really about finding hospitals that have beds for the people that need to be treated. It's not so much they're being overrun anymore, but rather just being able to communicate with all the other hospitals to get the people in that need help. But in one of the articles that I read here today, as a matter of fact, it was talking about there's this rise in the total numbers, but there's a substantial decline right now in the new cases, right? So new transmissions. So that's a really interesting thing, that it looks like this self-isolation or the social distancing seems to be working, because I guess about a month ago, the new case rate per day was like 76%. And now they're saying it's like 8% or something like that. So that number is dropping, even though we're finding out about people who have it at a higher rate. So is that really the issue now, is about beds and treatment long-term for the people that are coming in, as opposed to being afraid that there's tons of brand new transmission?
No, I think that's absolutely the case. And I think, honestly, we were all talking about this the other day. We started seeing these people, because you can tell who has it by their x-ray. It seems to be very characteristic. I mean, we were seeing a lot of this in February. Half of our staff was sick. Half of our doctors were out. And everybody was testing negative for the flu. We actually think this started spreading a lot earlier than when we started testing for it. And so I think the number of people infected was steadily rising. We just started finding out about it in March. So I think it's spreading, it already spread to a large percentage of the population. They just gotten better. So I think the new infection rate is probably going down. I think that social distancing is working. It is helping the hospitals. And you're absolutely right. Now it's just about finding beds for all these people. The good news is, like Henry Ford, Beaumont, a lot of these hospitals, even St. John's, we're starting to discharge patients, which is good. So now we're reaching more of a steady state. I actually trained at Beaumont. That place was overrun every February at baseline. We had patients in hallways. We were holding inpatients. It's just a massive hospital. And so I think we do have a plan. We do have incident command. We do have ICU beds right now. We do have hospital beds, but it's just a matter of where do we put, if we have to do overflow from the ICUs, where are we going to put them? Are we going to open up a PACU and call in nurses? It's a staffing issue more than anything. And I think there are hospitals out there that have open beds. Like I'm at River District. They have about 30 beds. We only had 5 patients in-house when I was working yesterday. So we can start offloading patients to some of these smaller hospitals that aren't overrun. We just need to, I think, improve our communication and start accepting the transfers, because a lot of the hospitals are afraid, well, I'm not overrun right now, but what happens in a week? I don't want to take all these patients. Well, in a week, a lot of these patients would have been discharged. And I know they've set up Cobo Arena in case we need it, which is great. That's already the Army Corps of Engineers has already got it set up. We're just trying to work out staffing issues. Some of the DMC docs I've heard are trying to open Connor Creek again, which is a hospital that had been shut down, but it has ventilators, it has oxygen, it has rooms. We could just reopen the doors, get some staffing, and we could start putting people there if we had to. So there are plans in place for some of this overflow if we need it.
Staffing is a real issue. And then, yesterday there were some nurses and others that were walking off the job, and because of a lack of PPEs and all of that necessary equipment. In your estimation, when is that going to slow down? When are they finally going to catch up with regard to the PPEs? Maybe Dr. Singh, that might be a good one for you. I know you've been working specifically on masks and all those kinds of things. Is there going to be a time here when all these nurses and doctors are going to get what they need when they need it?
Right. Well, Michelle and myself and like you, we've been talking about this. There is help. We've actually have access. I've spent a greater part of the last 3 weeks looking all over for resources globally. So we've been approached by not only international people, but we're looking at international markets, but we're looking at our own. We wanted to start with Michigan and look after this first. And so we've sent letters to Lansing. We've sent letters to elsewhere. You're part of that. And we're also raising funds to help provide masks. I actually spoke to another friend of mine who's oncology that needs the N95 masks. So we're looking at physicians and healthcare providers, and we're taking an inventory: who needs it, who doesn't. And Michelle, probably you can be part of that and helping us out to get us the logistical information of who needs these things, so we can help get, like, I guess, like she said, communication is very important in this matter, where days and weeks matter. And so we need this information now, not tomorrow. So we're trying to compile it and then provide it. And that's what our goal is right now for this next few weeks to months.
Right. So then, Michelle, with your experience, the nurses and doctors that walked off yesterday, and it was because of their lack of equipment and things like that, is that widespread, or do you think that that's hospital to hospital? Is that more of a localized issue here in the state?
I think that's definitely more hospital to hospital. I actually brought some stuff so everybody can see what we're talking about. If we have to intubate patients, we have like the big spacesuit hoods and stuff if we're going to be more exposed. Otherwise, what we're using is kind of these type doohickeys where you put this on. And then I've got my N95 mask, which is the more protective mask than this, because this has a lot of air that goes around it. So you'll hear like when they're talking about everybody should be wearing these. It helps protect other people, but it doesn't necessarily protect you from getting the virus because the particles are too small. So we use the N95s. The issue is the N95s are harder to get. So we're putting these on, and then we're having to put the mask over it so we can keep it clean. So that way we can use it for up to 2 to 3 shifts. I think in the very beginning of this whole thing, everybody panicked. Patients were grabbing handfuls of masks as they were walking out of the hospital. Staff was grabbing stuff and taking it home. And we're also used to in this country just having a readily available source. So we walk into a room, we put the mask on, we walk out of the room, we throw it out. Well, we were going through thousands of masks a day doing that. And, you know, given the production shortages that we're having now, we really had to change the way we protect ourselves. And so they're saying, you know, you get 1 mask per shift now, you get this hood, you know, we have some disposable ones, which you clean. I think a lot of people, that's very stressful to them to think, oh my God, I'm wearing 1 mask per shift. Is that safe? It is safe. And I've been talking to a lot of doctors that do medicine around the world, and like in Haiti, they don't even have an x-ray machine. They don't have gowns, they don't have gloves. If you're an inpatient, you bring your own sheets and medications, you know? So I think we are protected. We do have enough stuff for the next few weeks, but there is that stress of like, what happens if we run out? So we really appreciate like Dr. Singh's efforts in getting us some supplies. I know the White House task force was contacting hospitals directly because Michigan is one of the only states that hasn't submitted our proposal and what we need. And so we're behind on that. And I think like, you know, the politicians really need to get their butts in gear because we are going to need a lot of things. And it's scary to think we might run out.
I saw a thing just recently. I agree with you on that. I saw a thing just recently that said that the governor's office, the state has acquired or has orders in for 20 million masks. And, you know, we're going to need more than that, obviously. Just the number of masks, because the preference is 1 mask, 1 patient, right? Or 1 mask, 1 day, whatever. And so that's a scary thing that our government has already moved at our state government is moving at such a slow pace, getting their paperwork put in compared to some of the other states. So that may be why it's so important for the local people, you know, the people on the ground, on the streets, the grandmothers and the ladies and the men that are staying home, sewing those extra protective masks and all that kind of stuff is so important because Americans are always best when we're not sitting around waiting for the government, when we step up and we go after a problem and try to solve it as best we can with what we have. And so several of the ladies here at our church, they've been doing that, sewing up the extra mask, the covering mask. But I did have a question about that. I've seen a lot of people who have the self-made masks and, you know, if they go grocery shopping or something, but I also have seen a lot of people driving down the street wearing their homemade mask while they're driving. I'm not sure if they're afraid that they're going to give themselves the coronavirus or whatever. But for the most part, you mentioned this, and I just wanted to reiterate it. For the most part, when we're wearing those personal masks for ourselves, that's to prevent us giving the disease to somebody else through a cough or a sneeze or just the normal moisture that leaves our mouth while we're talking. Isn't that right? We're not trying to prevent ourselves from getting it when we're wearing a mask. We're trying to prevent other people from getting that. Is that right?
That is correct. That is true. The requirements right now for wearing the mask is actually, especially those homemade ones, is really to prevent us getting water droplets. Or when we speak, we found that when we're speaking to others, you know, some people do it more than others. They just, you can see this just
You guys are a second now. Not going to give it to you.
This bombardment of spit that's just going out and just in trajectory form. So it is to prevent that person giving it. And I think some people just feel a self-well-being that they're doing this.
Sure.
Remember,
so it has the same effect as us just walking around with our arm,
right.
our arm over our mouth, right?
Right.
It's essentially we're covering our mouth when we're coughing, only we're doing it all the time so we don't forget. Isn't that
Right.
really why we would wear those personal masks like that?
I think there's part of it psychological, but I think at the end there's the real reason of not spreading the disease. And so remember what we've been told is that we shouldn't have a false sense of reassurance that we're not going to get this disease by doing that. So we should still continue to maintain our social distancing. We should follow all the rules of hand washing and not touching. And so follow all these rules, even though you're wearing this mask, because remember going back a couple of weeks when we were talking about this, we cannot have a false sense of protection. The real protection is following all those other guidelines.
So we just had a question come in, and I think this is interesting. In New York, a tiger tested positive for coronavirus. And this is a really interesting question. Several people have asked, should we be concerned about our pets and them passing it on to us? Can we give our pets in the coronavirus, and can they give it back to us?
Well, this disease, we're learning. This is all new to us. We don't even know these vectors. This is an interesting disease that's crossing vectors. I was surprised when I went to a cat. We know that it's been transmitted to dogs. We know that it's been transmitted to cats, and I guess that would make sense that it would go to a larger cat. And the fact that this is really rare, that these disease states can jump from a human host to an animal host. And so it is fascinating and it is worrisome. So that is, I guess, as we're doing more research, we'll get more information. We should take every precaution with our pets. I have a golden retriever, a puppy, and we're still taking care of making sure that he doesn't go and he's quarantined as well. He's quarantined to the lawn. He doesn't go to the neighbor. He runs to the neighbor. He wants to greet everybody and go, no. When he goes out, we put him on a leash and make sure that he doesn't go either contacts another person or brings it back to us. Yeah. So he's quarantined as well.
Yeah, I have noticed on a lighter note, I have noticed most house cats look a little irritated that you're walking around in their house anyways. Maybe now they have legitimate reason. They're afraid that you're going to bring the coronavirus back. Here's another question that came up. Is it okay to go on long bike rides or runs right now, right? Should I avoid exerting myself, or is that okay?
Michelle, you want to take that one?
So this is the way I look at this. I had a patient that came in the other day and said, Doc, I'm really concerned about coronavirus. And I said, listen to me, like 280,000 people die of obesity-related complications a year. 30,000 people die of flu, and 480,000 people die of smoking-related illnesses. So you smoke, you're overweight, and you never get a flu shot. Let's start there. And he just kind of laughed and said, I ain't gonna do that stuff. And I said, yeah, but you can't fault me for trying. So I think, getting outside, exercising, you're not around somebody who's going to be coughing. I mean, it's more of a mental health thing at this point and a physical health thing. We can't just sit around in our houses all day. I think the divorce rate's going to go through the roof. Like, you got to get out. You got to exercise. I don't think Corona's your biggest risk at that point. Just, don't go into a crowded spot.
Yeah, we talked on our last episode about how to avoid getting the Corona 15, right? The quarantine 15, right? You're putting on 15 pounds just because we're sitting on the couch. I did tell my mom the other day, though, that I never thought, and she always told me I couldn't do it, save the world sitting on the couch watching TV. But I kind of am right now, I think, right? I'm sitting on the couch watching TV and trying to save the world. But yeah, the exertion thing, I think, is the question. So I'm out there and I'm jogging and I run past somebody else and I'm breathing particularly deep now because I just ran a mile or two. And yeah, I think that's some of the fear. But on the other hand, the mental health side of this is equally important. You had mentioned before suicides going up and divorce rates going up. That mental health side, when we're stuck inside, many people feeling trapped, in closer contact with other people, a lack of the endorphins and all those things that get released when we're exercising that just brings pleasure long-term and good health. That's going to be a significant issue, I think, even beyond this time. We've been working hard with our recovery program here at the church to make sure that we're keeping in contact as much as possible with everybody that is in recovery right now, because it's easy to slip into trying to self-medicate when you're feeling bad, and you're trying to compensate for the fact that you're nervous or you're afraid and maybe slip back into bad habits. Do you have any numbers on that? Have you heard anything yet with regard to the number of people slipping back into bad habits or anything like that? Have either one of you heard anything?
I haven't heard anything about the statistics, but I saw 5 patients that OD'd and got Narcan on my last shift. Just from what we're seeing, and this is not an isolated shift. This is like every shift we're seeing, or people that are getting drunk and getting caught by the police driving or falling downstairs, or because all the liquor stores are still open and everybody's bored and sitting at home. And so I think that is, and we lost 80 something thousand due to drug overdoses last year. So this is like a real problem.
Right. Yeah, I'm not sure how liquor stores are considered essential. That's been a surprising thing to me.
Mental health. I don't know. You got to find a titratable amount.
Yeah. Well, I will say McDonald's has been essential to me. I've probably hit the drive-through 4 or 5 times in the last couple of weeks. So yeah, I guess I get it. But yeah. Well, Dr. Singh, as we're getting ready to wrap up, do you have any final thoughts before we'll hand it up to Michelle as well?
Sure. Again, this is all new. I tell the American public in our areas and in the world that not to be in fear. Don't be fearful. Plan, and we'll be stronger. We'll get through this, and we're here for you. We won't abandon you. We will be here with you all the time. And so we ask that you stay united and stay safe and stay sound.
Michelle, do you have anything that you'd like to say?
I think the only thing I wanted to touch on really quick was the ventilator issue, because I think a lot of people are afraid they're going to get very sick and there aren't going to be ventilators. We have a bunch of new ventilators coming in, is what I've been told. But right now we are using the normal ventilators. We have portable ventilators. We are using BiPAP machines. We are using the OR machines. And then we actually did research out of St. John through Dr. Babcock, that you can actually put 2 to 4 patients on one ventilator if you had to. So she's been video conferencing with New Jersey and New York to teach them how to do it. So that way that this won't be a concern anymore. We are not going to run out of ventilators. I think the other thing that's creating a lot of fear and panic are these refrigerator trucks. And everybody's saying, well, look at them, they have a refrigerator truck. And I know there's been some talk about getting them in Detroit, and I don't want people to freak out when they see that on the news. What is happening is we usually take people down into our morgue, and then funeral homes come and pick these people up. And right now, nobody can have funerals. So a lot of people are holding off on doing this and storing the bodies. Well, the funeral homes are backing up. They only have so much storage available as well. And they don't want their staff exposed to all the coronavirus, among other things. So I think that's why the hospitals are considering doing this. It's not because so many people are dying at once that we can't handle it. It's because nobody can have a funeral. And I think that's something that you probably deal with a lot, just because people are worried that their family member is now dying by themselves. They have 9 kids and they're in the hospital and nobody's allowed to visit. And we can't have a funeral to mourn these people. And I think we maybe have to start change, as we start opening things up, maybe make that one of the first policies we change so that people can deal with some of this grief.
Yeah, the grief side of it so far has been very difficult because, like you said, people, when they do pass away, the family usually isn't able to be with them. But one of the encouragement that we would give to people is make sure you're leveraging technology now. Use FaceTime as much as possible, just like you would when you were in the room. I know several of the hospitals are saying it's okay, bring up a small care package for your family members, and the nurses will make sure that they get it to them. Try to make as much normalcy as possible. Keep the conversations going as much as possible. Keep the phones charged or the iPads charged or whatever, so that communication can happen. Because what you don't want is when somebody is really struggling, you don't want them to just fail to thrive because they don't have anybody connecting with them. And then the family members themselves need to know that they had contact. And Martin Luther said it, man, if God comes looking for me, he will surely find me, right? We all have an appointment. Life is 100% terminal. So the best way to live is to be prepared for that final breath, and to make sure that we're engaging with people well, that we are loving the people that are in our family, in our friend network, and that we're communicating with them and not putting that off. And now not being able to go to the hospital at the last minute just puts us in a situation where we have to prepare a little bit better. And thank God for the technology to be able to do so that way. But let me just encourage you, as Dr. Singh did as well, that you're not alone in this, and this is very serious. And like I mentioned, the number of new cases we're discovering is going up, but it appears that the infection rate is really dropping substantially, and it's because the American people, for the most part, have been trying to follow these basic guidelines for social distancing and all those kinds of things. So hopefully we're going to come to the end of this devastating period over the next few weeks. But we have to hunker down. We have to continue to do our part to make sure that we don't spread it over these next few weeks. And then gradually, as Michelle referenced, it looks like it'll gradually start to come back to normal things. I think that the last things that you'll see are the large crowd events, right? The sporting events and the large church services and the theatrical plays and those kinds of things, because now we have lots of people in a small space. But I do think that it's going to loosen up. Restaurants are going to open back up. Stores will start to open back up. And we're all just going to be way more conscious of the social distancing kind of thing. But you're not alone. Stay connected. Dr. Burks, in one of the phone calls that we mentioned, or that we had a few days ago, she mentioned that social distancing should not equal social isolation. And so right now, we all have a lot more free time, many of us. And so make sure now is the time. Don't hold off. If you think of a good thing to say, call somebody and say it. If you think of a good thing to do, just do it, right? Don't hold off. And one of the temptations when you have so much free time is to just put things off and you think you get to it later. My basement still needs to be cleaned. I can't believe it. I have all this free time and I still haven't gone down there because I'm going to do it tomorrow. And we do the same thing a lot of times when it comes to saying a good word. Man, if you think of something good to tell your mom or your dad or your brother or your sister, call them and tell them, FaceTime them. Don't just call, look at them, right? This human interaction is important. But we want to thank you guys for joining us today as we're getting ready to wrap up. And our questions have continued to come in. And if we have any more, we'll make sure we do that. We'll be posting this to Facebook and then I think on YouTube as well. But thank you guys so much. I just want to remind our viewers as well that at heritagechurch.com, if you want to get help, if you need help, we're feeding hundreds and hundreds of people. We're providing extra food to hospitals around the area. If you need help, click on the Need Help button. And then also there's a Give Help button. If you want to help us buy N95 masks, we're still collecting money for those that we'll be able to use on a local level. And then also being able to give food to the doctors and the nurses and to those people that are in need here in the area. There's so many other opportunities as well. So make sure you check out heritagechurch.com and drbishamsingh.com. You can get more information with regard to the government's recommendations on these things and also more on Dr. Singh's campaign. Well, thank you guys so much for joining us and thank you for watching today another episode of The Doctors in the House. We'll see you next time.